Finishing Chapter 14, ETI on page 83. Increased intracranial pressure, ICP, monitored by placing a screw, catheter, or sensor through a burr hole into the ventricle or the subarachnoid, epidural, or subdural space. Expected reference range is 10 to 15 mmHg for ICP. ICP can be increased by hypercarbia, so that is the high carbon dioxide, which leads to cerebral vasodilation. Endotracheal or oral tracheal suctioning can also increase ICP. Coughing, extreme neck or hip flexion extension, maintaining the head of the bed at an angle of less than 30 degrees, increasing intra-abdominal pressure, restrictive clothing, and Valsalva maneuver also all increase ICP. Implement actions that decrease ICP. Elevate head at least 30 degrees to reduce ICP and to promote venous drainage. Avoid extreme flexion, extension, or rotation of the head, and maintain the body in a midline neutral position. Maintain a patent airway, provide mechanical ventilation as indicated, administer oxygen as indicated to maintain PaO2 of greater than 60 mmHg. Remember, normal is 80 to 100. The client should receive stool softeners and avoid the Valsalva maneuver with increased ICP to avoid the straining from constipation. Provide a calm, restful environment, limit visitors, minimize noise. Brief periods of hyperventilation for the intubated client can be used after the first 24 hours following injury to help lower ICP. During the first 24 hours, hyperventilation can cause cerebral vasoconstriction, which can cause ischemia. Medications used with ICP would be mannitol. Mannitol is an osmotic diuretic used to treat cerebral edema. When used for increased ICP, the medication draws fluid from the brain into the blood. Nursing actions are to administer IV to treat acute cerebral edema. Insert indwelling urinary catheter to monitor fluid and renal status. Monitor electrolytes and osmolarity closely. Barbiturates. Client can be placed in a coma, barbiturate coma, to decrease cellular metabolic demand until ICP can be decreased. Commonly used medications include pentobarbital and thiopental. Thiopental. When barbiturate coma is used, the ability to assess neurologic function is made more difficult. Medication dosage is adjusted to keep the client completely unresponsive. Mechanical ventilation, cardiac and hemodynamic monitoring, and ICP monitoring are required. Fentanyl is used prophylactically to prevent or treat seizures. It was the first medication used to suppress seizure that did not depress the entire CNS. Dosing for this medication is client-specific and based on therapeutic blood levels. Nursing actions are to check for medication interactions. Opioids is another medication. Morphine sulfate or fentanyl are analgesics used to control pain and restlessness. Nursing actions are to avoid opioid use with clients who are not mechanically ventilated due to CNS depressant effects, prevents accurate assessment of neurologic system, and can cause respiratory depression. Administer naloxone, the reversal agent, if client becomes overmedicated or does not tolerate the opioids. This completes page 83 ATI.